Today we'll be talking about how to use ultrasound to diagnose Achilles tendon ruptures. Achilles tendon ruptures due to overuse from repetitive activities such as running and jumping. The Achilles tendon connects the gastroc and soleus to the calcaneus. Ruptures typically occur 2 to 6 centimeters proximal to the calcaneal insertion. To begin your exam, you want to have your patient lying prone with their foot hanging over the edge of the bed. A high-frequency linear probe is used since we'll be looking at a superficial structure. To obtain the sagittal view, you want to make sure that the probe marker is facing towards the patient's head. Here's a video demonstrating how to obtain the sagittal view. You begin at the calcaneus and move your way up towards approximately the mid-calf. Here's an image demonstrating the Achilles tendon in sagittal view inserting onto the calcaneus. This hyperechoic structure is your calcaneus, and this fibular-like structure is your Achilles tendon. The Achilles tendon in sagittal view should have uniform thickness and echogenicity. Next, you want to obtain your transverse view. Remember to always scan in 2 planes. To do so, you're going to rotate your probe 90 degrees with the indicator towards the patient's left side. If you take a look at the image above, here's the Achilles tendon in transverse view. In transverse view, the Achilles tendon is mostly flat or concave anterior margins. If you take a look at this image, this is an Achilles tendon rupture in sagittal view. It no longer has its smooth fibular appearance. If you aren't sure if you see a rupture or not, you can always manipulate and move the joint in many planes to assess for what you are looking for. Partial thickness tears can appear as areas of hypo or anechoic echogenicity within the tendon, disrupting the fibers. Full thickness tears have completely disrupted tendon fibers and can have tendon retraction or changes in the contour of the tendon. In transverse view, what you'll see is a mass-like appearance, typically representing an Achilles tendon rupture. In transverse view, when you do see a rupture, you'll see non-visualization of the tendon, loss of fibular architecture, and fluid collections, usually representing a hematoma. So remember, to perform your exam, use your linear probe, have your patient lying prone with their foot flexed, scan in both sagittal and transverse views. As you can see, ultrasound is fast and cost-effective and provides us with dynamic imaging correlating with patient symptoms.